Hey, Katie.
Hi, Mr. Sanders. My name is Matt. I'm a student nurse. I'm here to make an assessment on you. You're a day post-op after your appendectomy. I'm going to just look at your surgical site.
Okay, ow. Ow.
Okay. Yeah. I'm going to also listen to your lung sounds. You know, I don't hear anything. But I think we're going to have to use this. You know, I can't really remember how to use this. I'm going to have to call the doctor. Dr. O'Hara.
What seems to be the problem?
This man, I was thinking about
What is
using...
this? Why do you have this? He doesn't need this.
Okay. Well, I was listening for his lung sounds and I couldn't really hear anything.
There's nothing there.
But
What's happening
it
here?
Hurts.
Right here?
Ow, 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 it hurts.
You're fine. Maybe some just Tylenol. He'll be okay. Remember, just stay in bed. Don't get up. Don't deep breathe. No coughing. Don't move. No fluids. Okay?
Oh, okay.
Just sit there.
Okay.
God, I'm busy. God, I'm busy.
That will help you.
Hello, I'm registered student nurse Doug. The scene that you just witnessed, let's be honest, had a lot of errors. Now let's see where we can make some improvements. For example, our patient here was having a little bit of difficulty breathing. Some simple interactions such as raising the head of the bed, increasing his mobility, using the incentive spirometer, using an incentive spirometer, deep breaths and coughing to prevent atelectasis and hospital-acquired pneumonia, and also simple measures such as washing your hands to prevent infection.
Let's see the facts again. Pneumonia is the most common hospital-acquired infection in the United States. It most often affects infants and children, people over 65, and those immunocompromised. Remember to assess the oral membranes and notify the physician of any breaks in the membranes. The interventions mentioned help prevent atelectasis, promote mobilization of secretions, oxygen diffusion, and full chest expansion to increase perfusion to the lungs.
Now let's take a look at a professional nurse who's going to do it correctly.
Hello, Mr. Sanchez. How are you?
I'm good. I'm just kind of having a hard time breathing.
Oh, yeah? I'm raising the head of the bed. I'm Nurse Jackie. So you said you're having a hard time breathing?
Yeah.
Take a deep breath. Deeper. Okay, I'm moving my staff. Now I need to listen to the back. Breathe. Again. 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 Very good. I can tell you're not using your incentive spirometer. This measures your inspired volume. Every time you breathe in, slow, deep breaths. You want to demonstrate for me?
Okay.
You should breathe in slower.
Practicing slow, deep breaths, especially after post-operation, helps prevent atelectasis, thereby preventing pneumonia.
Good. You should do this about 10 times an hour.
Okay.
Measure how well you're doing with this little yellow tab.
Okay.
In 30 minutes, I'm going to ambulate you.
Okay.
Great.
I'm going to go ahead and measure your temperature now. Temperature reading of 100.1. That's not too bad.
My arm really hurts though.
Well, let me take a look at it.
Ow, ow, oh.
It looks okay. It's just the IV. Maybe you're uncomfortable having an IV line in. It should be okay. You know what? Just to make sure though, I'm going to talk to the doctor real quick. Dr. O'Hara.
Seems to be the problem.
Well, I found out that this patient has little pain in his arm, and he's also kind of running a low-grade temperature.
He's fine.
Ow, that hurts.
He'll be fine. Just give him some normal saline, whatever. He'll be okay. I
Okay,
gotta go. I have a
thanks.
lunch meeting.
Thanks, Dr. O'Hara.
Hi folks, registered student nurse Doug here once more. The previous scene
Was littered with mistakes. So here's how to prevent IV site infections. Keep the infusion flowing at the prescribed rate, stabilize the catheter with correct taping and a splint, maintain strict aseptic technique, change catheters and tubing every 48 to 72 hours as prescribed.
let's take a look at Nurse Zoe, who's going to be coming in and performing the proper procedure for an IV check and preventing infection at the IV site.
Mr. Sanchez, I just have your temperature left to take. Beep. It's 100.4, so you have a little bit of a low-grade fever. Now I'm going to check your IV site. How does this feel?
Ow, that hurts.
Feels a little warm. And you can see the redness around and up the vein. When's the last time you had your IV changed?
I don't remember when they changed it.
Oh, well I'm going to have to check that. It looks like it might be infected, which is called phlebitis.
Sir, do you have to urinate?
Wait. Excuse me, sir. I'm gonna look. Oh. Hey, Doc. I think his bladder's pretty distended here.
Yeah. Spaga reservation for 6 o'clock tonight. Somebody put a Foley in that guy.
Sir, we're gonna transfer you now.
Ali!
Mr. Francois, the doctor orders to put in a Foley catheter to help with your pain.
Okay, Buffon, put it in. Ali,
Yeah.
Ali.
I'll go get it. Oh, look, I found one in his neighbor's area. Here you go. Oh, here's some gloves.
They're way too small.
We don't need them anyway. We washed our hands.
Nah, we're fine.
Here, I'll put some lube on.
Ali.
Have you seen my Chien? I was walking him through the park. He's a French poodle. Oh! Little Pierre, my little Chien. He ran out with my baguette. Ah! Oh!
Mr. Francois, I brought you your water.
Oh. When I'm on the Riviera, I only drink espresso. You know this.
Doctor, this patient seems
Good.
confused.
Where is my poodle?
If this patient is agitated, give him some Ativan, 2 milligrams.
Hi, registered student nurse Dom here, filling in for my brother Doug. He's in Paris right now. What you've just seen is the improper technique to insert a Foley catheter. This may promote a catheter-acquired infection, otherwise known as a CAUTI. To insert the catheter properly, you're going to want to use a sterile technique. You want to make sure that daily you provide proper Foley care. Another thing you need to do, properly document when you inserted the catheter, the patient's response, and how much liquid you inserted into the balloon. And of course, you don't want to leave the catheter in for longer than 72 hours. CODI are the third most common type of healthcare-associated infections, accounting for more than 30% by acute care hospitals. 80% of these hospital-acquired urinary tract infections are attributable to indwelling urethral catheters. CODI has been associated with increased morbidity, mortality, hospital cost, and length of stay. Insert catheters only for appropriate indications. Ensure that only properly trained persons insert and maintain catheters, and maintain a closed drainage system, and maintain unobstructed urine flow. I'd like to introduce you to a friend of mine. It's Dr. B. Ryan. Hey, Dr. B. Ryan.
Hello.
Why don't you explain to them the proper method of inserting a Foley catheter to minimize a CODI?
Thank you.
After donning sterile gloves, dispense the lubricant into the container. Then, rip open the iodine and disperse amongst the cotton balls. Grasp the penis at the shaft, straight up and down, while you clean the meatus in a circular motion. 2 times. Next, dip the catheter into the lubricant and insert into the urethra.
Thanks for watching our film on hospital-acquired infection.
And don't forget, when you get a bladder infection,
You're in trouble!